delighted to be joined by Dr Bnar Talabani BME. She's a hospital doctor in kidney and transplant medicine, an immunology scientist, and has been a Team Halo guide. So yeah, hello Bnar.
Hello, good evening. Thank you for inviting me along.
No problem at all. To begin with, it would be great to find out a bit more about yourself and how you came to be involved in Team Halo.
So my colleagues and I, so I'm based in Cardiff. I'm a doctor training to be a kidney and transplant specialist and currently doing my PhD in immunology with a view to doing both research and clinical work long term and marrying the two up together to be a clinician scientist. So in January, we noticed there was a lot of hesitancy around the COVID vaccines just among people that we knew. These are people who would often have their medications and any other vaccines without any hesitation, but were particularly hesitant about this vaccine. And we opted to do something about it and got together to form a group called MDC and have made lots of different content in social media, really targeting ethnic minority groups to make essentially different content webinar in different languages. That was the key, different languages. And that work really took off, and we've continued that and have now expanded to do lots of other things like mental health and other different campaigns. Around April, I was invited to join Team Halo, which is essentially the same thing, but on a global scale. And there are people like myself, Team Halo guides, who volunteer our time to create social media content. And we are nurses, doctors, scientists, psychologists from different disciplines, different specialties. And that's what we've been doing for the past coming up to a year and a half now.
Mm-hmm. And why do you think the work of Team Halo is so important?
So I think that because the majority of the nonsense, the misinformation, disinformation being shared is actually being shared on social media itself. So it makes sense that we use social media to share accurate information, evidence-based information. And I think the reason Team Halo itself is really important is because not only is it beneficial for people to be able to access that content, but somebody like myself who hasn't been on the wards looking after COVID patients, for example, but who has the knowledge to understand the immunology, the science behind the COVID vaccines. If there's a question about managing COVID, when someone asks me that and I don't know the answer, I can tap into that resource of my other Team Halo colleagues who are experts who bring those different expertise from their backgrounds. And it's been a great source of support for me when I've been targeted, like we all have with some anti-vaxxer abuse and things. So it's a really great movement, and it's a privilege to be a part of it. And actually, I think moving forward, I think we should normalize professionals being on social media, sharing expertise, advice, and just evidence, teaching people the difference between scientifically backed information and just not the one that lacks evidence and that people try to share on social media.
Yeah, it seems like a really collaborative process that's going on. So what would you say have been its biggest successes?
I think the biggest success has been that we are a collective effort. We're a team, and we are sharing essentially the same information, because it's pretty much the same questions that keep coming up again and again and again. But we're making different content. Making different ways to address that misinformation and that hesitancy. And the fact that we're all from different walks of life and speak different languages, I think, is a lovely way to be able to address misinformation across the globe. There is still a lot of work to be done, but last I checked, we've had something like 267 million views. So it's great, and I think it needs to continue.
Mm-hmm. And then on the other side, what do you think have been some of the biggest challenges that Team Halo has faced?
Yeah, I think the biggest problem with mis and disinformation is that it's a bit of a monster. You cut off one head and three other heads appear. And I've dealt with very sensible questions like, well, if the vaccines are produced so quickly, how do we know they're safe? I think that's a very sensible, legitimate concern that's actually easily addressable when you understand the process of how they were produced. But then there are other things like the vaccines. There have been ridiculous claims about vaccines increasing your chance of contracting HIV recently, and you just think, what? How did that even? It's just as you're trying to address one bit of nonsense that comes out, something else comes along, and it's difficult because the way that misinformation plays on fear makes it go viral compared to sensible scientific evidence-based advice. And we need to change that. We need to change how people get their information and how people balance the information that they get to understand how to. I think we need to improve science literacy to explain what evidence actually is. So ultimately, so we can facilitate informed decision making.
Mm-hmm. And I think that's something that's really come through in terms of, we're about to now ask some questions that we got both through Parents United, who are hosting this event, and through the COVID aid community as well. There's definitely like a kind of big range about that. So some of the first ones that we had were around the vaccine. So the first question here is, I've heard people say this is an experimental vaccine and has been approved for emergency use. Is it safer to wait and see what the long-term effects are?
Okay, so that's two things. So first of all, has it been approved? And second is long-term issues. How do we know that there's not going to be long-term issues? So initially, this was given emergency approval, but now lots of countries around the world, including the USA and the FDA, has given full approval to the vaccines that we're using. It's still under emergency use in the UK, but I'm not entirely sure why that is. How do we know it's safe? Well, if you'd asked me this question over a year ago, I would have said, yeah, we've got really good clinical trial data saying it's safe. Now we've not just got the clinical trials data from hundreds of thousands of people, we've actually given 10 billion doses worldwide. And when you understand how vaccines work and when side effects present, you'll know that vaccine side effects always present within a few weeks of having each dose. So the latest we've ever seen a vaccine side effect after each dose is 8 weeks. The vast majority will actually present within 3 weeks of each dose. So that's number one. So actually we have given the vaccine long ago enough to see the side effects that we're going to see. And because we've given it to 10 billion doses, sorry, about half the world's population, if you bear in mind, some have had 2 doses, some have had 3 doses. Because we've given 10 billion doses, we've now given enough doses and to enough people to know even the extremely rare side effects. So actually we have the information that we need, and we know we're not going to, sprout a second head 2 years down the line. That's just not going to happen, because we've had the time frame and the amount of doses given to be able to understand that. So no, it's not experimental. The reason it's referred to as experimental by some is because we do what's called continuous monitoring once we approve a vaccine or a new medication for use. And the reason that's important is because we don't include certain groups in clinical trials. So for example, I look after transplant patients, we don't include transplant patients in clinical trials. We give them the vaccine because once it's been proven safe and effective, which it has in clinical trials, we then want to protect them against COVID, but we also want to be able to continually monitor them to see what their level of protection is with the vaccine, because we don't get that from the trial data. And that's why the continuous monitoring is so important. And we do that for all medications, all vaccines, not just these ones.
Yeah, thank you very much. The next question is, I've seen other online comments say they know more people who have died from having the vaccination than the virus itself, including sports people. Is this correct?
No, it's not correct. And I think as a rule of thumb, getting your information from social media is the worry there. Actually, what's really good is that we've had really huge, large-scale studies done looking at people who've just had the vaccination, people who've just had COVID. This is right at the beginning when we've now kind of got to the situation where people have had both. We're talking studies of 30 million people, and what we've seen is that every single rare serious side effects that we see in the vaccine, which are thankfully rare, are actually far, far more common in COVID infection itself, and often much more severe. So myocarditis, inflammation of the heart in all age groups, including young children, is actually more common with COVID infection than it is with COVID vaccination. And when we see it in COVID infection, it's mild, always recovers. We have not had any children or anyone die from that. Whereas we have had adults have severe myocarditis and other heart complications with COVID infection, either resulting in death or in some cases requiring transplantation. So the balance of vaccination there.
Yeah, and on that note, there's a question here that says, I've heard the vaccine causes heart problems such as myocarditis. This is making me unsure about vaccination for me and my family.
Yeah, good question. And again, because I think the thing to bear in mind is when we see stuff on social media, we think, oh, okay, well, if this is true, then why would I have the vaccine? But the way to make a decision is not to say, well, I've seen this and therefore I'm worried. It's to say, what are the risks with the vaccine and what are the risks with COVID, and where am I going to get that information from? And you want to get it from reliable sources that will give you accurate numbers from each side. And the way that we do that is by large scale studies and by the continuous monitoring that I was just talking about. And all of that data has shown that, again, myocarditis is much more common in COVID infection and often much more severe. So for me, thankfully, I don't have any underlying health conditions. I'm relatively young. It was a no-brainer to have the vaccination because my risks with all the things that we worry about is always more common with COVID infection. And bear in mind that COVID infection doesn't just cause myocarditis, it causes funny heart rhythms that can result in sudden death. It can cause all sorts of other heart complications, lung problems, liver problems, all sorts of other organ issues. Whereas we know that vaccine side effects are very, very rare and they tend to be much fewer complications than we see with COVID infection itself.
Mm-hmm. And we've just had a question from Glo, who says there are findings of thrombosis in people who have passed away due to the virus. Is there any considerations or extra protection put into the chemistry of the vaccine to counteract the threat of thrombosis?
Yes, so very good question. So one of the studies that I was just talking about was done on 29.1 million people, where people were either in the vaccinated group or they'd had COVID. And in fact, every single type of clot that we know about are all quite common in COVID infection, but one or two of them also happen in vaccination, but are still much more common in COVID infection. So clots as a whole, thrombosis as a whole, is much more common with COVID infection than it is with vaccination. A really big study actually just out of Cardiff University with one of the profs who is in our department published explaining why we think this clot's risk even exists with the AstraZeneca vaccine. And it's likely this is going to lead to a better understanding of why this is, and hopefully to be able to tweak the vaccine to reduce or completely eliminate the risk of this risk from being there. But I think, again, it's a balance of risk and benefits, isn't it? And the only reason we or that the government decided to not offer the AstraZeneca vaccine to younger age groups is because there were alternatives. Actually, even if there weren't alternatives, it would have still been much better and would have made much more sense to offer the vaccine because, again, all of those risks of clots are, again, much higher in COVID infection.
Yeah, thank you very much for that response. In terms of next questions, then some more around kind of vaccines. So how can the vaccine still be working if it was made for the first variants? And the follow-up is, will we need new vaccines for every variant that pops up?
Really good question. So this is based on the fact that with the flu, because it mutates such a fast rate each year, we have to update our vaccines based on a strain that we see in places like Australia, then we vaccinate for it here. So by the time it makes its way to us in winter, we have to give that dose for that strain. No, we don't have to do that with COVID as of yet, from what we have seen so far. The reason for that is because the virus, the COVID virus, doesn't mutate to the same degree that the flu virus does. But each time we've seen a mutation, the way that we know that the vaccines work against it is by doing two different types of studies. One study is where we actually mix people's blood who've had the vaccine in with the virus in the lab to see if the antibodies that we form can actually hang on to the spike protein. Because the way that the antibodies work is they latch onto the spike protein, meaning that it can't then enter then the actual virus can't enter our cells. The spike protein that we produce as a result of the vaccine is not to be confused with the spike protein that we have in the virus. By itself, the spike protein is completely harmless, but as part of the whole virus, it just helps the virus enter our cells, and that's how we get ill. So you may have heard rumors about spike protein, the vaccine doing rubbish to us. It cannot, it's not possible for it to cause us any harm. The other way that we check that the vaccine is effective is by populational data, and that's looking at hospitalization rates in people who've had vaccinations and boosters, for example. So what we know about Omicron is that, yeah, it can change the shape of the spike protein, but if we have enough antibodies, i.e. we boost our immunity by having the booster vaccine, we do produce enough antibodies to be able to reduce infection rates with the Omicron significantly, but much more importantly, it actually boosts our protection against hospitalization, and that maintains for a good time afterwards.
And then next question around the effects as well. I have seen comments online that the vaccine affects our genes. Is this true?
No. No. Very simply, I'll just use my hand. This is so our body and our organs are made up of lots of different types of cells. But very broadly speaking, our cells look like this. In the middle is where the nucleus is, and the outside is what cytoplasm is. The nucleus is where our DNA is kept. The vaccine stays in the cytoplasm, does its job here, and then the contents are removed from the body very shortly after vaccine. It does not enter or come near our nucleus. It doesn't come into contact with our DNA, so it cannot change it.
I like the use of the hand. It makes it much more clear for myself as well as hopefully the person asking the question. Also, yeah, is there, this is something I've heard other people ask and inquire about, is there evidence that vaccination reduces the chance of developing long COVID? And is there any evidence that vaccination reduces symptoms for people who are living with long COVID?
Yeah, really good question. So we do have good evidence that the vaccines reduce long COVID. The only reason I hesitate is because we don't have a definition of long COVID. It's very difficult to say what the vaccines actually reduce. But more and more studies have been done looking at people who have had vaccinations, have had COVID, have not had either. To see what the rate of symptoms are for all the symptoms that we see long COVID. And what we've seen from all the different studies we've seen is that vaccines do reduce long COVID. So even if you are somebody who has a breakthrough infection after vaccination, your chance of having long COVID is still lower than someone who's not vaccinated. In terms of, do the vaccines help people who've already developed long COVID? Well, that's a really good question, because this data is anecdotal. What that means is that we haven't got large-scale data to answer that question just yet, but the bits of information that we have from different small case studies and case series, so published bits here and there, suggest that yes, they do. So very broadly speaking, it's a rule of thirds. For a third of people, their symptoms improve and then stay better. For a third of people, they improve, but then after a while they come back. And for a third of people, the vaccines make no difference to their long COVID symptoms. There is currently a study going on, I believe, in Exeter University, looking at giving repeated vaccination doses to people who've got long COVID to see if that has an impact on their symptoms. We're still awaiting the results of that, but that's what I'm aware of. And I think the advice, rightly, is that even if you've had COVID and you've got long COVID, to go ahead and get your vaccination. But the advice is also to await for your symptoms to stabilize, so not to have a really bad peak of, whatever your symptoms, shortness of breath, whatever, to have like a decent couple of days, and then you can go and have your vaccines as normal.
We've had somebody ask a follow-up in terms of which vaccines is it that seem like they might reduce long COVID?
Yeah, I don't know, and I don't think it matters. I think it's from the data that I've seen, it's a mishmash. So I don't think it's any specific vaccine that's better than the other. I think the reason the proposed mechanism by which we think this that this is actually beneficial is that one of the proposed mechanisms for long COVID is that there is an inability to clear the virus from the body. And so people who have it are continuously expending a lot of energy trying to clear the virus from their body and are just not able to. And what the vaccine does is it induces a robust enough immune response that you can clear the virus properly. One of the other mechanisms is that because we know COVID causes clots, when we talk about clots, we talk about big clots that cause, PEs and strokes and things in COVID. One of the proposed mechanisms for long COVID is that we also get microemboli, so smaller clots that cause end organ damage that we don't immediately see. And the thing about long COVID, I think people need to realize, is that it's a bit of an odd one. You can have a very mild initial COVID infection and then weeks later develop long COVID symptoms and months and months. If you hospitalized, that's who develops long COVID. Actually, about a third of people had very mild infection to begin with and then went on to develop long COVID in the long term, sadly.
And then in terms of this question is around natural immunity versus vaccination, and which lasts longer.
Yeah, good question. So I'll explain why natural immunity isn't as robust. And I think people often, there are studies suggesting that natural immunity is as good. It isn't. And the reason that's often confused is because when we develop, so I'll just go back to basics, use my hand again. This is the COVID virus. On top of the virus sits lots of different projections that are proteins. One of these proteins is the spike protein. When we it's actually the spike protein that helps the virus to enter our cells and cause its damage. So what we want to do is we want to produce antibodies against the spike protein, because when you produce antibodies against it, it locks onto the spike protein, and then it'll just stay around our body, but it will not be able to enter our cells. And then our secondary immunity, so T cells, B cells, and other specialist cells, will then recognize the virus and then just gobble it up and get rid of it. But it's the antibody that prevents infection in the first place. When you have a vaccine, you only produce antibodies against the spike protein, so they are all neutralizing antibodies. But when you have natural infection, I say natural, when you have infection, you produce antibodies. A third of people produce no antibodies at all. Not sure why that is, but those that do will produce antibodies against all the different proteins, and that means only a small proportion are actually neutralizing antibodies that we need to protect us. That's why infection doesn't always confer the same degree of immunity, number one. Number two, we also know that even if you were to produce proper antibodies, the right type of neutralizing antibodies, it doesn't last as long as vaccine-induced immunity. And we saw that particularly with the Omicron variant, where the people who are more likely to get COVID were those who were not vaccinated or who had previous COVID, because that previous infection did not confer the same protection as people who were vaccinated and then boosted. But that's why vaccine-induced immunity is always better. The only thing better than vaccine-induced immunity is people who've had their vaccinations and then also had a COVID infection, because all you're doing is you're topping up your immune. I'm not saying go and catch COVID if you've had your vaccine. That's not what I'm saying at all. But if you do catch COVID after your vaccination, it does top up your immunity even more.
Mm-hmm. I guess that kind of leads into, got a few questions around boosters. Mm-hmm. And there's two questions I think maybe are kind of close enough in a sense that's maybe worth asking both. So the first is, if the vaccine works, why do we need top-up boosters? Mm-hmm. And then the second is, no other childhood vaccines require top-up vaccinations. Why does this one?
Okay, the first question, why do we need boosters if the vaccine works? I'm going to flip that on its head and say, if the vaccine didn't work, we wouldn't be using it as boosters. The reason we needed boosters is because Omicron changed the game. And because unfortunately, so the ironic thing about these vaccines is they are some of the most effective vaccines that have ever been produced, ever. And actually, if we had vaccinated enough people right at the beginning, when we're dealing with the first original variant of COVID, we would have eradicated the virus by now. But we didn't vaccinate enough people, either because people were hesitant to take it up, or because we didn't get it to the global market to give it to countries who are poorer than us and who still haven't been able to access vaccines. And that in itself is an argument for vaccine inequity and trying to address that. But the reason we need boosters is because over time, protection against infection, but not protection against severe disease, will wane. And so the reason we need boosters is because we've not yet vaccinated enough people in the population to achieve something called herd immunity. And the reason herd immunity is really important is because that means when we vaccinate enough people in the population develops immunity against the virus, not just the individuals who are vaccinated, because those who are vaccinated act as barriers to those who are not vaccinated. So if one or two people have the virus, we act as barriers to prevent the virus from spreading to other people and then having an epidemic, so an outbreak. The really good example of that is the measles epidemic in the USA. So in 1991, there was a measles epidemic in the USA where somebody from outside the US who was not vaccinated with measles came to the US and went to a music concert. I don't know what music concert, but I know it was a music concert. And that individual spread measles to a few other individuals who they were standing around. Now, measles is just as infective as I think the Delta variant, but probably, so it's a very, very infective virus. but that person passed it to vaccinated individuals. So they had the virus, but weren't unwell with it, didn't become very ill. And it didn't actually become an epidemic. So it didn't reach the stage where it spreads really, really fast and causes an outbreak until the virus infected someone who was not vaccinated. When the person who was non-vaccinated got the virus, that virus then spread really fast among both vaccinated and unvaccinated, meaning in 1991, everybody had to have a measles booster. So boosters are not just a reflection of the vaccine's ability to work against a virus, they're also a reflection of how much virus there is in the population and who else in the population is vaccinated. Now, why bother giving everybody a booster if the majority are vaccinated and they're not going to get ill from it? Because actually, even if you were to catch measles at that point, but you were vaccinated, your risk of having severe disease is very low because you've had your underlying vaccination and some immunity. Because you have to bring the virus under control as a population, because if you don't, it can mutate. If you don't, it can infect the most vulnerable, who, even if they are vaccinated, will not derive the same protection. And if you don't, you're going to have to think about other measures to bring the virus under control. Otherwise, healthcare systems can become overwhelmed, which is what we've seen happen with COVID. So that's why boosters are important. And now with this virus, and we either give boosters or we go back to social measures of lockdowns and other things that are disruptive. So that's kind of the balance that we have to strike.
Mm-hmm. Yeah, like you said, it's certainly something that with rates rising in the moment is a very pertinent question to be asking. Another one along those lines, I heard vaccine immunity wanes after 3 to 4 months with the third jab. So after that, are we back to square one?
No, not quite. So vaccine produces two types of protection. One is protection against infection in the first place, and the second is protection against severe disease and hospitalization and death. The protection against hospitalization, death, severe disease actually maintains really well from the data that we've seen. So that's not to worry about. We are offering boosters for the clinically extremely vulnerable, because even a slight drop in protection in severe disease for them is a big difference compared to the general healthy population. So that's a separate issue that I'm happy to cover, but I'm not going to complicate the question with. Protection against infection. So what we have from the data is, so immunology is really cool. Obviously, I think it's cool, but you don't have to think, you have to agree. With vaccination, so each time you give a booster, you're not just boosting how many antibodies you produce and the B cells and T cells that you have that protect you against severe disease. You're also actually telling your immune system, this virus is still around and it's still mutating, and it's still changing to new variants. So what your immune system does is actually, its ability to react to new variants improves each time it has a booster, even if it's a variant that it hasn't come across or that's not even around yet, okay? I'm not going to bore you with how that is, but we know that a really, really good study published in Nature, the best journal, has basically broken that down. It's really, really great paper. And what we do with this particular booster is when we give the booster dose for this vaccine, we actually boost our antibodies, which prevent infection, to a degree much higher than what we've seen the second vaccine. And even after some time, that number does come down, but it's still much higher than with the second dose anyway. So although we have waning immunity, it doesn't mean that the immunity is gone. It just means it's not as good as when you had it immediately after the vaccine. But the actual protection that you get maintains for a good long time. So your risk of infection is still significantly reduced months after your booster, but much more importantly, your risk of severe disease just stays at the high level that it should.
We had another question that was very much along similar lines. And this is somebody asking about the protection somebody has from this 2 vaccinations and a booster and how long it lasts for. The reason that they were asking for is they're concerned that their clinically vulnerable mum, age 73, won't get a booster at the same time as their dad, who isn't clinically vulnerable and is age 76.
Yeah, good question. So that does fall into the clinically extremely vulnerable category. So I'm just going to address that very quickly. There are a small group of people in this country and across the world who are classed as clinically extremely vulnerable, have an underlying condition that suppresses their immune system, or because they're on medication that suppresses their immune system. For example, transplant patients, you have to have immunosuppressants so they don't reject the transplant that they have. Those individuals are at incredibly increased risk of COVID without vaccination. What we see with vaccination is that we do, for the vast majority, they do get very good protection from the vaccine, but it wanes more quickly than if someone doesn't have that has an immunocompetent, so a healthy immune system. So for those individuals, they have a completely different vaccination regime to the rest of us. And the reason for that is because they need more vaccines or more frequent vaccines to get the same level of protection. So the individual asking that question, totally get where you're coming from. But in addition to following the vaccination schedule, both your mum and your dad, there are other measures that you can put in place to reduce the risk of transmission. So your mum will have a different schedule to your dad because she needs that different schedule to get the same protection that your dad will have got. And there are other measures like mask wearing, good ventilation, but we don't talk enough about good ventilation. Good ventilation is very, very good at reducing transmission of COVID. Having open windows regularly or continuously and then wrapping up warm, with weather becoming nicer outside, hopefully in the next few months, that will be a lot easier. We'll see transmission rates reduce as a result, particularly in schools and other areas that we see high cases of COVID. The other thing you can do, if you can afford it, is buy an air filter. Any air filter that can filter a 0.3 micron size particle is fine. They're not that expensive and they do work really well. Happy to share a summary of, I'm not going to recommend an air filter because I'm not going to advertise for a company, but happy to share a summary of the requirements. You can have a look and see what you need. We've got one in our house because, my daughter, thankfully, is young and healthy, so not really at risk of severe COVID, but I don't want her to be off nursery. So really, I'm trying to reduce the risk of us having transmission in the house. We're all vaccinated. We have an air filter, windows are open. If I get together with people, we do lateral flow tests. All of these things that you can do to reduce the risk of transmission will help.
Yeah, and I think that brings us on to some questions around children. So the first of these is, what reassurance can you give on the safety of COVID vaccination for children aged 5 to 11?
Yeah, really good question. So the UK has been an outlier in offering the COVID vaccine to children later than other countries around the world. The US, I think, was the first country or one of the first countries to offer it to this age group. And last I checked about a month ago, around 10 million doses had been given, so I'm sure it'll be much more now. And it was, and because the clinical trials for this age group started a few months ago, we've now again had long enough to see those side effects that will present within a few weeks of having each dose, and we've given it to enough children to see what the rarer but more serious side effects are. And again, what we've seen is that the side effects that we see that are serious are thankfully even rarer in children than they have been in other age groups. Still more common in COVID infection. And so myocarditis, again, inflammation of the heart, is thankfully incredibly rare in children. The rate is 2 per million for girls and 4 per million in boys, all completely recover. And when I say recover, they recover with fluids and ibuprofen. So it's not something that we hospitalize for. We do admit into hospital to investigate, to diagnose it. Then kids go home and then get better by themselves. So that's the reassurance. The data is there. The data is very reassuring. And, I'm talking here as a doctor and scientist, but I'm first and foremost a mum. And my daughter, when she turns 5 in September, will be getting her, probably on her birthday actually, will be getting her COVID vaccine, because vaccines are always safer than the condition that we are protecting against, always.
Yeah, and that leads right on to the next question, which I've seen many people say a version of this before. And that's Omicron is mild and children don't suffer severe illness, only a cold. Why would I vaccinate my child?
Yeah, good question. Omicron is milder because we vaccinated so many people. I think we need to realize that is the way that that's been portrayed in the media is actually very unhelpful. Omicron is, yes, less likely to cause an individual to end up in hospital, but a virus that's more infective will actually make more people ill overall, because the way that impacts hospitalization is an exponential rise as opposed to a linear one. I'm not going to bore you about mathematical modeling, but the point is that actually the reason Omicron is mild, the reason we've gotten away with it, is because we've vaccinated a decent size of our population and the most vulnerable. It is true that Omicron is milder, but actually we have seen we've actually seen more hospitalizations in children with Omicron than we saw with Delta, and more with Delta than we saw with the other variants of COVID. And that's been the case in the UK, in the US, and other parts of the world. Number one, thankfully, hospitalizations and death are incredibly rare in pediatric, in kids, but they do happen, and they do happen to healthy children. And it beggars belief to me that we would deny a vaccine that can prevent that, even if it's stupidly rare as a possibility that can happen. And we know the vaccine works really well in preventing that. And the other thing that COVID does, again, very rare, is something called PIMS or MISC, depending on which part of the world you're from. And PIMS or MISC is a condition that is similar to a hyperinflammatory thing that we see with other viruses, but behaves slightly differently. So children will often have a mild COVID infection and will recover. And then about 6 weeks later, will develop abdominal pain, rash, temperature, fever, and swollen eyes, swollen mouth, and will end up in hospital. And that is very severe. Again, thankfully, very, very rare, but very severe. Vaccinations reduce that by more than 90%. And then there's long COVID. We don't talk about long COVID enough, I think, for adults, but we certainly don't talk about it enough for children. There are currently an estimated 117,000 children, 16 and younger, with long COVID in the UK. We know the vaccines reduce long COVID risk. We know that long COVID can, on the whole, be quite debilitating. I mean, if it's just tiredness you're dealing with, that's quite debilitating if you can't do your daily activities and just play and be a kid. But we've also seen the spectrum of long COVID where kids are losing weight and have to be NG fed. They have organ damage, some are wheelchair bound, some have had brain damage because of, so, this is not a benign condition. And again, for me as a mum, although the risks are low with COVID, because the vaccine is safe, to me, it's a no-brainer. I will be vaccinating my child because although the risk is small, I've done my bit to protect her and reduce the risk of her developing any of those complications. If and when, because it really is a matter of when she contracts COVID, because all measures are going to be lifted soon. So for me, it's a vaccine or virus. It's always going to be vaccine.
Mm-hmm. Thank you. I'm aware we've got a few minutes left, and I've got a few more questions to go through, but if anybody here wants to ask a question, then please do write it down in the chat, or you can unmute yourselves and ask if you wish. Yeah, another question around children, quite a specific one. Is there a difference in the pediatric dosage for a booster? If not, was the optimal time for a recommended booster for children? Ours got their second one in December, and we're considering returning them to school, but I would like them to be boosted if there's any benefit at all prior to returning.
Yeah, so good question. So the booster is needed to give that really good protection against Omicron. So the 2 doses will provide protection against severe disease, but it will not stop people catching Omicron. But the protection against severe is only about 2/3. To really boost that protection to more than 90% against severe disease and to reduce the risk of infection significantly, you need the booster. In terms of timings and dosage, the pediatric dose for 5 to 11-year-olds are 1/3 of what the adult dose is. And that's simply because kids have a more reactive immune system and need less of a message. That's essentially what a vaccine is. It's you're telling your immune system, this is something you need to be aware of. Go and get ready, go and get your defenses ready. Because they have a more reactive immune system, they need less of a dose to be able to get the same protection. And in terms of the interval between doses, we say 12 weeks, because there is a slightly teeny tiny induced risk of an increased risk of causing myocarditis if you give it sooner. It's not, it's not a huge risk at all. And actually, when you consider the risk of myocarditis small to begin with, it really is a tiny risk. But because we know about it, then it kind of makes sense to put that 12-week gap between each dose and COVID infection itself. So if you again had COVID in the meantime, you need to wait that 12 weeks to have your, this is just for pediatric, by the way, not for adults. Adults can have it, whatever the recommendation is, which is about 28 days.
And then we've got a final couple of questions around fertility and pregnancy. So first of these, does the vaccine affect fertility?
nope, no data to back up this claim, but unfortunately, like all misinformation, it went viral before the scientific community could go, what are you talking about? And actually, we've had loads of really good data, really good published studies, large sample sizes have completely disproven this person's claim. Vaccines cannot and do not impact fertility. There is no plausible mechanism by which any vaccine for these ones could impact fertility. So lots of really good data proving that they don't impact fertility at all. COVID infection doesn't seem to impact fertility in women, but it does in men. COVID infection increases the risk of erectile dysfunction in men, young and old, by a factor of at least 6. So we're seeing issues with really young men. It's one of the long COVID symptoms that we're seeing. So yeah, COVID can impact fertility, vaccines do not.
And then is the vaccine safe in pregnancy?
Yeah, again, really good question. So how do we know it's safe in pregnancy? Well, some of the women in the clinical trials unintentionally went on to get pregnant and went on to have healthy babies with no complications. That was a small sample size, but since then we've given the vaccine to around 200,000 women in the USA and other parts of the world. And again, with continuous monitoring, multiple studies, we now know that it's safe for mum, it's safe for baby. The vaccine content do not cross the placenta at all. But the antibodies, so the protective antibodies that mum makes to protect herself, does cross the placenta. And we've just had a study published in the last week or so that has shown that the risk of hospitalization for COVID for young babies is significantly lower in mums who had the vaccine versus mums who didn't. And COVID, unfortunately, in pregnancy doubles to triples the risk of stillbirth, baby being born early, baby being born small for weight, needing NICU, neonatal ICU care, and maternal mortality, so mums dying. So if you take anything away from today, it's if you're pregnant or know anybody who is, please plead with them to have the vaccine, because the rate of people needing the highest level of care that we can offer in medicine, there's a disproportionate number of pregnant women who are unvaccinated needing that care, just purely because of misinformation. They haven't had their vaccine, and it's totally preventable. The vaccine's safe, it works really well.
And yeah, finally, we've had, it's not a question, it's a comment from somebody who just says they found the discussion very helpful. The conversation around myocarditis has been really informative and better than any response I've had from my GP practice. Thank you again. It's very reassuring, as both my sons have had the vaccine. So yeah,
you're welcome.
Thank you.
So yeah, welcome. And I honestly wish I could. I mean, I'm counting down the days until I can get my daughter vaccinated. She's starting school in September, and I know cases in schools are very high. So just for my own peace of mind, I'd like for her to have the vaccine, when I know I've done my bit to protect her, and then that's it really. So I'm glad you found it useful, and I am on social media, so if there's anything that any questions you want to ask, or if you again have people who are hesitant you want to talk to, you can just share my videos without having to engage in that dialogue, which can be quite difficult sometimes. But yeah, anything I can do, please do shout.